Thank you, Gary. Thank you, Gary, for your remarks. Next, I want to turn to Jessica Nickel from the Addiction Policy Forum. Jessica, thank you for coming today. Appreciate you being here.
Thank you, Governor Christie, and members of the Commission for having us here today and for focusing on this important issue. My name is Jessica Nickel, and I'm the president of the Addiction Policy Forum. I've been in this field for about 26 years now. I started in prevention and have worked in treatment and criminal justice, and I founded the Addiction Policy Forum to focus on a comprehensive response, prevention, treatment, recovery support, overdose reversal, law enforcement strategies, and criminal justice reform, and also to be a voice for the families that are impacted. I love my job. I get to work every day with families, and we have about 4 million families in our network that take the darkest, hardest moments of their life and turn it into change and fire in their belly to help their communities, their neighborhoods, so other families don't have to endure the same devastation. We're grateful for your focus on this and for the Commission's work on this crisis, and it is a crisis. Every day in America, we lose 144 people to drug overdoses. That's equivalent to 2 sold-out 747s crashing every single week for an entire year. Or put another way, imagine a sold-out Yankee Stadium and losing everyone in that stadium over the course of a year. And we have launched an awareness campaign to give a voice for our families, and you have some of these in your packets of information. And I wanted to share a little bit of a reminder of the families that are at the epicenter of this epidemic. This is Courtney Griffin. Courtney's parents lost her at just 20 years old. Her dad, Doug, describes Courtney as a shining star. The room lit up when she walked in, and everyone loved her. He writes, "We were told that because it is not a matter of life or death, there would be no coverage for treatment by their insurance provider. On the advice of local authorities, we asked her to leave our home and canceled her insurance, and by doing this, she would be homeless and could be eligible to receive treatment. Courtney died alone, away from our home, on the day before she was scheduled to enter drug treatment." This is Dylan and Matthew. And Dylan and Matthew's mom, Denise, describes her boys as the loves of her life. She lost them both to opioid use disorder, to drug overdoses. And she says to us, "My boys had a bright future ahead of them. Because of their illness and lack of adequate treatment and medical coverage, their lives were cut tragically short. Had they suffered from diabetes or skin cancer, they would have been provided the medical care and attention that they needed to live a full life." And this is April and her daughter. And April's mom, Annie, tells us that the hardest thing that she's ever done is to tell her 4-year-old granddaughter that her mommy had died and what that meant. "We love and miss my beautiful daughter every day and will for the rest of our lives." And this is Terry and Annette, my parents. I've been in this field for a really long time for personal reason, and I know firsthand the impact that this has on families. Both of my parents struggled with heroin use disorder, which for me and my little sister meant homelessness and hunger and living on the streets and foster care and eventually being placed with our grandparents. It's hard to sort of underestimate the impact on children that are impacted by parental substance use and all of the instability and the uncertainty that means. My father never found a way out of that disease, and he died way too young at the age of 48. My mom did find help, and through a drug court before it was a drug court, right? It was just a judge that really cared and helped her to make a change in her life through a methadone clinic and the combination of recovery support services. And she had 19 years in recovery when I lost her, way too young at the age of 50 because of the long-term health impacts that opioid use disorder has, even when you're in recovery. And I, every day, sort of do this work in sort of their memory, and I'm very proud of my mom and the work that she did to get to that point of having her 19 years, 2 weeks short of her 20th anniversary. And we know right now that we have an incredible treatment gap in this country. Of the 21 million people that need treatment help, only 10% will receive it. Can you imagine if 10% of cancer or Alzheimer's patients receive treatment? Just 10%. But we can do better. Us at the Addiction Policy Forum, we envision a world where fewer lives are lost and help exists for the millions of Americans that are impacted, and it is millions. And we envision, we sort of ask on a daily basis, what if, right? What if? What if we treated addiction across this nation like a disease with continuous individualized treatment and follow-up for each patient? What if every child in our nation's schools had the adequate dosage of prevention starting early and followed up at home? One of the most important things is delaying the age of onset for alcohol and marijuana use, and we need to do a better job of telling parents that. What if we had robust services for those in recovery, from recovery housing and schools to community services? What if every patient who needed it had access to the 3 medications that have been approved by the FDA for treating opioid use disorder: methadone, buprenorphine, and naltrexone? What if we treated individuals with substance use disorders through our healthcare system instead of through our criminal justice system, then shackling people with criminal justice histories for the rest of their lives? And what if we use science to inform our response and measure how successful we are in stopping this deadly disease? We're working to advance each of these areas every day at the Addiction Policy Forum. And in our written statement, we have over 60 recommendations, but they fall in 7 key buckets that we think of as sort of the organizing tool to understand the full comprehensive response that we need to do a better job, because we can do better. And those buckets are overdose interventions, treatment, advancing treatment, prevention, protecting children impacted by parental substance use disorder. Really, really important that we don't forget about going a little upstream to talk about the kids that are impacted, kids like me. And there are ways, and there's lots of hope on how we can intervene to help them, but we need to start working on that today. Expanding recovery support services and reframing our criminal justice system. So I'll only give you 1 or 2, because I'm pretty sure I don't have time for 63 recommendations, but yeah, pretty certain. Our highest priority right now is on the overdose intervention side. Naloxone is so important. Equipping our first responders, our hospitals with Narcan, huge priority. But using the moment of intervention in an overdose, and we know that those that have had a non-fatal overdose are at the most risk for another overdose and death. So making sure that we're working with our states and jurisdictions to implement interventions and protocols from emergency rooms and health systems to our first responders, educating and training families. This is our top priority right now as an organization, and I think it is the most needed as we look at this worsening epidemic. And our recommendations in this department are for overdose patients in emergency rooms, to ensure each patient leaves with a treatment plan and a warm handoff to behavioral health. Train clinicians and staff to offer MAT and provide naloxone. Conduct trainings to discuss with patients how to reduce risk for future overdose. We can't get them into treatment if we can't save them in the first place. And then the other recommendation in this bucket is to change HIPAA laws to allow for family notification after an overdose reversal. My mom, Amy, who lost her son, Emmett, found out that after she lost him that there had been multiple overdose reversals with no family notification and no ability to use that as a moment for the family to come in and wrap around their loved one. And I think he was 19, so just outside of sort of being an adult, but still being in need of that. We've heard from some press reports that this is an area that the Commission is looking at, and we fully support that change. It's something you can do that would save millions of lives. The second bucket is resources for families, and Marcia mentioned this earlier. Our biggest gap is helping families in crisis. And I try to describe to folks, because I've lost a total of 6 family members to this disease. It's a whole generation of my family that was just wiped out. And when you are in the middle of it, it feels like you're drowning. It's hard to find where to go or who can help you or how you navigate your way out of this. So if we can do a much better job, and through awareness campaigns and using the services and resources are out there to connect families in crisis with the help that they need to get their loved ones in treatment and have that long-term treatment plan in place. The third bucket is to advance treatment. I mentioned that we have an enormous treatment gap, and there's a lot of things that we can do to close that in short order. Our first recommendation is to commission an IOM report on how to restructure the treatment system to address the pervasive systemic issues between workforce shortages, billing models, lack of training, getting training into medical schools, you name it, to really look at this from a broader lens. Our second recommendation is to remove addiction from the IMD exclusion. It shouldn't have been there in the first place, and it's a very, very simple, common sense way to deal with our treatment gap. The third is to educate providers, patients, health plans, payers, everyone on all FDA-approved medication-assisted treatment options, and to make sure that we make those available. And then in the treatment sort of bucket, but still in the research, we need to invest in more research to have more medications and more technology and more interventions. We want to cure. We want what other diseases fight for in terms of more resources. We want to be partners with our white lab coats and industry to help us do a better job here. And then the fourth bucket is create recovery-ready communities. Our research and our clinicians are pretty clear that folks need a 3 to 5 year recovery plan. That's 3 to 5 years that you need to wrap folks up that have a substance use disorder. And to do that, we need to have all of the programs in place to support recovery in every community. And in our written testimony, we lay out 10 key components of a recovery-ready community, and it's our vision that every single county in America will have all 10 of those. On the prevention side, we know that 90% of adolescents, or we know that addiction starts in adolescence for 90% of people. So investing in prevention is worth it and incredibly important. Our two top recommendations there are to invest in prevention in schools, to require it, and use some of the evidence-based programs that are already out there, like Strengthening Families and Life Skills. They're there. NIDA has great evidence around them, and getting them to disseminate things like assemblies and whatnot, those don't work. So making sure that we're being clearer with our schools on the do's and don'ts and giving them the evidence behind what they can implement. And the second area, which is a little bit in that canyon between early intervention and prevention, but to implement student assistance programs in every school to make sure that we're intervening early. Addiction isn't very different from other diseases. We need early detection and early intervention to have better patient outcomes. And student assistance programs are a key element in that. That's when this disease begins in adolescence.
I have to ask you to wrap up, Jessica.
All right. The two other quick buckets are, one, we need to protect children impacted by parental substance use disorder. Kids like me can turn out great, but we just need to invest in them and invest in them early. And then finally, I think we need to work to reframe our criminal justice system. We are recommending and working really hard on the sequential intercept model to have interventions in every point of the criminal justice system, not just one or two. And it's something that I think can have huge return on investment everywhere from arrest to prosecution, probation, prison and jail, and reentry. And we're here as a partner to you as you work on these things.
Thank you, Jessica. Appreciate your testimony and your commitment to the issue very much.